So we're joined today by Dr. Stephen Houston, a vitreoretinal surgeon in Florida Retina Institute. Welcome.
Thank you. Thank you for having me today.
So with the timing of the ASRS meeting right now and recent advancements in some more retina surgery technology, we wanted to talk to you with regard to your surgical experience with an upgrade to some of the technology that's out there, for instance, the Ingenuity 1.4 upgrade from Alcon. Could you speak a little bit more about what are the upgrades to that and what your experience has been with that so far?
Sure. So, the Ingenuity 1.4 software is going to be a nice addition to those surgeons out there that are using Ingenuity and those that are looking to potentially purchase the system. We've been using the Ingenuity now for about 3 or 4 years and really have loved the enhanced magnification, enhanced depth of field, which, are all great features to the Ingenuity, and including the ability to kind of sit up, having a little more ergonomic control there. The 1.4 software, though, is going to be really nice because it's going to kind of add on to those features where it's going to be easier for staff and physicians to white balance. And then the other thing is that the data fusion is going to be a little more incorporated as well. So one thing that's really going to be a neat feature is color optimization. So before we talked a lot about kind of the visualization moving from analog to digital and then having the digital optimization of the image. Now we're going to move that a step ahead where we're going to be able to allow color optimization. So before, you're kind of set for a few different color channels on the Ingenuity system. And if you really wanted to kind of dive into some additional higher level color changes, you really had to go into settings, and you really had to have someone such as a fellow or other person that knew how to use the system into the settings to change things how you wanted to do. There was a few of us that were testing different settings, such as one with a decreased red for vitreous hemorrhage or diabetic type of cases. And you could preset those settings into the system. But now what they're going to have is individual tiles that are going to be overlaid, kind of picture in picture, if you could imagine, where you can be operating in one setting and then you'll be able to see 4 or 5 color channels off to the side that'll give you a taste of the different color channels there. So, when I was using it previously, one I really liked was a yellow filter, and that yellow filter gave a nice contrast when doing membrane peeling. There's also, like I said, this kind of a decreased red filter, which allows to cut out a lot of the red when you're doing vitreous hemorrhage cases or other where there's a lot of blood. And those will be kind of previewed on the screen, and then all you have to do is take the cursor and click on that, and then it will switch your view to that. So it's going to be a really nice seamless way that we're going to be able to switch between these color filters to really tailor, each step of the procedure, that there may be certain color filters or color optimization that we want to have, and we can quickly now transition between those. So that's going to be a really nice feature for the 1.4 software, kind of integrating that data fusion on a more advanced level from the color channel standpoint. From a non-retina, obviously I'm a vitreoretinal surgeon, so I like to focus on that. From a non-retina perspective, though, for our cataract surgeon colleagues, another good feature is that it's going to be integrated with the Centurion and the Aura. So they're going to have that ability to better integrate with the data fusion to have overlay of the Aura while they're operating. So for the anterior segment colleagues, that's going to be a critical feature that I know they're going to see value in having that on the screen. So those are kind of the main features that the 1.4 is coming out with. So from my perspective, having that initial digital switch, now that improved visualization, to now add on color optimization, really takes it that next step forward.
It sounds very intuitive and something that would be very beneficial in the practice. So I was wondering if you could talk a little bit how these improvements have supported, this ever-changing environment we're in, the operating space and the setup in the COVID environment.
Sure. So, in addition to obviously the enhancements from a visualization standpoint, which I think, can potentially lead to improved efficiency in the operating room, improved safety for patients, and improved outcomes. COVID definitely brings to light, a lot of concern regarding us as surgeons at the head of the bed, close to patients. And so, ophthalmology, early on has been identified as a high-risk specialty. So when we started operating, we were still operating during the lockdown on emergency cases, but it started to become difficult to, really comply with all of the PPE requirements. Currently, it's recommended to have, a mask and then even eye protection. And when you're operating at a microscope, it's very difficult to wear any kind of eye protection with the microscope oculars. So, we've really started to look at how Ingenuity can provide an enhanced ability for us to facilitate PPE in our regards, whether it's, eye protection or other things. It also allows us to better space in the OR. So instead of being kind of up close in the oculars, we're able to sit back more with the ergonomic heads up aspect of the Ingenuity. That includes, scrub techs and fellows and residents that may have to be huddled around the microscope at a side scope. Now people can see the same view of the surgeon, but be spaced back a little bit and not be kind of around the patient in that regard. So it really kind of potentially enhances safety in the operating room because we can better space of staff and the physicians in that regard. So with COVID and the concerns around it, something that allows me to feel a little more safer in the operating room, both for myself, for my staff, and for my patients, I think is a critical part of it as well.
Mm-hmm. And that's great. I'm sure a lot of surgeons will be really benefiting from your information you're sharing with us right now, as technology is available as of late July. So I'm sure they're eager to start using that in their practices as well. And so also, I just wanted to kind of ask you, lastly, what are you most excited about in the field of retina at this particular time that we're in?
Sure. I mean, I think, the field of retina, I'm thankful every day that I, stumbled my way into it, because it's just amazing the colleagues we have, the people we have in the field that continue to push it forward, both from a pharmaceutical standpoint, medical device standpoint, and then just the research and innovation that goes on in retina is exciting. COVID brings to light a lot of, interesting perspectives regarding, how do we best see patients in clinic in a socially distanced manner. So a lot of excitement for me comes from potential for telemedicine and even remote patient monitoring, as we start to see a lot of the pharma companies developing either longer acting drugs, port delivery systems, whether there's additional genetic treatments that are more longer lasting, and how do we potentially incorporate virtual care regarding telehealth solutions, whether it's more hybrid type of models or as we potentially get into home OCT and other things that, really pushing our field forward from an innovation standpoint and then pushing it into the virtual space as well. So I think a lot of the pharma and medical device developments, and then the current pandemic highlighting the virtual medicine, I think all of that will come together and really push us into a new paradigm as we move forward. So it kind of is one aspect that continues to excite me as well.
Dr. Stephen Houston, thank you.